King B News and Views with another video. Good evening to all who is tuned into this video. We have a medication warning. Article by Newsweek, released 9 hours ago. We're going to get into this article. Medication prescribed to 23 million Americans may cause bone loss. This sounds serious. A drug called levothyroxine, the second most commonly prescribed medication among older U.S. adults, has been linked to a higher risk of bone loss in a new study. Levothyroxine, I hope I'm saying that or pronouncing that correctly, is prescribed to treat hypothyroidism and underactive thyroid in approximately 23 million Americans, or 7% of the U.S. population, under various brand names, including Synthroid. But scientists have found that the drug may put older adults at risk of losing bone mass, a risk factor for the bone disease osteoporosis. Which osteoporosis is like brittle bones, which is a serious issue for older adults as they age. Our study suggests that even when following current guidelines, levothyroxine use appears to be associated with greater bone loss in older adults. Dr. Shadpour Demiri, I hope I said his last name right, co-senior author of the study and a professor of radiology at Johns Hopkins University, said in a statement. Hypothyroidism is a common condition whereby the thyroid gland does not produce enough of the hormone thyroxine, leading to fatigue, weight gain, hair loss, and other symptoms. While hypothyroidism can lead to serious and potentially fatal complications without treatment, it is possible to have too much thyroid hormone, a condition called hypothyroidism, which can lead to heart palpitations, high blood pressure, shakiness, anxiety, weight loss, and an increased risk of bone fractures. Data indicates that a significant proportion of thyroid hormone prescriptions may be given to older adults without hypothyroidism, raising concerns about subsequent relative excess of thyroid hormone, even when treatment is targeted to reference range goals, said lead author Dr. Elena Gottby, a postdoctoral research fellow at Johns Hopkins School of Medicine in Maryland. Gottby's team found that taking levothyroxine may put patients at risk of bone loss, which may lead to conditions such as osteoporosis, a bone disease characterized by weak bones that break more easily. Losing bone density is a normal part of the aging process, just like losing muscle mass, and particularly affects postmenopausal women. But in osteoporosis, some individuals can break ribs just by coughing or sneezing, or developing long-term chronic pain through partial breakages in the spine. In this study, due to be presented next week at an annual meeting of the Radiological Society of North America, a team of radiologists and endocrinologists specializing in X-rays and hormones respectively investigated the relationship between levothyroxine and bone loss over time. They used data from the Baltimore longitudinal study of aging, which involved adults over the age of 65 living in communities, but only studied older adults with healthy ranges of thyroid hormones. Of the study's subjects, 81 took levothyroxine and had normal thyroid hormone levels, and 364 did not take thyroid medication. After an average 6 years, the adults taking levothyroxine were more likely to have lost more bone mass and bone density compared to those not taking thyroid medications. Dr. Jennifer Mammon, co-senior author and an associate professor in endocrinology at Johns Hopkins said in a statement that adults taking levothyroxine should discuss the treatment with their healthcare providers and regularly monitor their thyroid function. A risk-benefit assessment should be conducted, weighing the strength of the indications for treatment against the potential adverse effects of levothyroxine in this population, she said. And that's the end of the article. Interesting article. And for those of you out there who have loved ones who are 65 or older who have their health issues, look after your loved ones. Make sure you're checking their medications because their medications could be causing more problems than the actual health condition. But this is thank you, baby. This is King B News and Views. Shout out to each and every one of you watching this video. Again, look after your loved ones, the elderly, right? Check their medications. Make sure you know what's going on with them, right? Accompany them to their doctor's appointments, and just make sure you are alert and you know what's going on as far as with their medications, right? And you have regular discussions with their doctors as well, so you know what's happening, you know what's going on. And of course, as always, love yourself unconditionally. Keep your loved ones close, right? Look after our babies, our children, our women, and look after the elderly too. Let me add that again, right? Hope everyone's having a safe and wonderful evening. This is King B. To the next video. Peace.